Hello, this is Paula Anderson with Paula Anderson Coaching Consulting. And today we are celebrating or acknowledging National Minority Mental Health Awareness Month. And today I have a special guest. Her name is Shelley. She is a psychotherapist, licensed professional counselor, and she's also a yoga instructor. So she's going to be talking a little bit about what is mental health and how you can take advantage of the opportunity to make sure that you are protecting your mental health in relation to if it's therapy that you need or if it's some form of self-care or mindfulness. So how are you doing today, Ashley?
I'm doing well. Thank you for having me.
Great. So let's start off by talking about mental health and what the scope of mental health entails.
Well, mental health can be a very broad space, a broad topic, and some ways to kind of bring that into a more acute space to identify areas such as the eight dimensions of wellness. And eight dimensions of wellness isn't necessarily like a go-to. I mean, it doesn't have to be the go-to, but it can be a great way for you to identify like maybe some aspects of mental health care that you would like to focus on. And those eight dimensions of wellness include, actually, I can just pull it up. That's a great way for us to kind of like start this conversation to give a sense of direction. And so, eight dimensions of wellness can help you really identify, okay, well, if I'm doing well in this area, but not necessarily in this area, what could mental health care look like for me? And so, the eight dimensions of wellness include spiritual, emotional, occupational, intellectual, environmental, financial, social, and physical. And anyone can Google this. This is actually a resource and a reference that a lot of therapists will refer to just to kind of see where a client is, even if they don't necessarily speak to it this rigidly, like in this structure. These are the components that we're really paying attention to. And so when we think about mental health and think about mental health care, this could be a great way for a person to kind of check in and say, okay, spiritually, I'm feeling okay. I'm going to church. The church family is feeling good. That I'm feeling good in. But physical, my physical body, that isn't really, I'm not really feeling good about it. It's not only like my body doesn't feel good, your body may feel good, but do you feel good about your body? Do you feel good about your physical wellness and where you are? And so then that can be a place to say, okay, well, how is this impacting me? What type of thoughts am I having? Am I criticizing myself? Do I find myself being very judgmental, not only of myself, but of others? If I'm pointing something out about somebody's body, is that something that I'm noticing in me? And then you realize, like, okay, well, that might be a place where I can actually talk to someone. And it doesn't have to be a mental health therapist, but, talk to a trusting person and saying, this is how I feel about this. And that may be an indication to say, this may be impacting my mental health and also mental health care practices. Occupational, we may feel confident. We may feel very good mentally and emotionally around our financial wellness and also the impact of the job that we're having to do, the occupational space that is being occupied. And that doesn't necessarily only have to be I'm not happy with my job. It could be the workplace environment. Is that creating stress? Is that creating worry? Do you feel as if you're not getting along with your coworkers? And so these are aspects of your life that you can really notice or allow yourself to bring attention to and say, okay, these are some places that I may want to place attention on my mental health and also mental health care. Mental health is literally how you're operating in this, how you are able to move through these aspects of your life, and mental health care is how you attend to those things. So that could be a umbrella aspect for people to be able to look into. Like these are the eight dimensions of wellness as an umbrella. And then also these are the parts underneath that umbrella that can help us bring attention to mental health and also mental health care practices.
Okay. Well, that was a great overview. So tell me, why do you think that there's still a stigma behind individuals seeking mental health services or behavioral health? Because that's the new terminology, behavioral health.
Behavioral health. Um, I mean, there's so many aspects of it. I'll be completely honest. I believe we can speak culturally for sure, but culturally isn't only about specific demographics. It's like the culture of your family. I work with clients now that their family isn't really approving of them attending to mental health therapy. And these are people who are adults, navigating their life. And so it's not necessarily that it influences their decision, but it does impact the way that they're able to approach it, meaning having the space and the capacity to talk about the things that you are learning in therapy, or having the space and the capacity to be able to just freely talk about the fact that you are going to therapy. So I believe there's still very much so this cultural implication that does impact stigma, and more than anything, how people perceive what therapy is. And so the idea of even people fear the things that they don't understand. People are uncomfortable with talking about their feelings. People are uncomfortable with talking about their family. One thing that I know for sure has shown up commonly in my therapy space, and also in practice with other therapists that I make sure that I maintain meaningful connection with in order to talk about these things. The idea of being able to talk about therapy, being able to talk about it with your family is really impactful. And so the culture around how people are showing up in their homes, but also how people are being perceived with what's going on in therapy, the perception of what are they going to do? Are they trying to read my mind? Are they trying to turn me against my family? All of these things, or, some of the things that are just very commonly heard is a parent saying, "Don't talk about me in therapy," or a parent saying, "You trying to blame me for it." So I believe it's really just this discomfort with, approaching the things that have been maybe not attended to, these things that have been attended to in very particular ways, such as we don't talk about it or just move on, get out of it, you being too emotional. So I believe the stigma of it really has to do with how people have been, how it's been presented to, and then also how people have just been interacting with therapy and the idea of therapy, what that actually is.
Okay. Well, you mentioned about cultures. One of the things that I've noticed with the generations is that Generation Z, they are more open to mental health awareness. They really don't have the barriers that maybe baby boomers and Generation Xers had, because they feel it as a sense of empowerment in trying to control what's going on in their lives. So, what are your thoughts about this generation really being very open to mental health and wellness?
Absolutely. I concur. And it's not all encompassing, it's not every single person, even in, the boomers and Generation X and things like that. Not every single person has the same approach. But I have noticed, just like you, that there is more commonly the generation now, their Generation Z, I think is how you refer to them. They're way more inclined. It's like they're looking for it. They want it. And then also we have to, well, there are things to consider to their variables, such as social media being such a meaningful part of like how they communicate, how they interact. And sometimes the things that you've taken in on social media, you want to sit down and talk to someone about it. It's a great way for them to have connection. And that's the part that I feel has also influenced it. Is nothing for my Generation Z clients to come in and say, yeah, TikTok therapy, they mentioned this, but then they want to come in and talk about it. So it's like this exposure of it that has in some way, and I try not to use this word too much, normalized it. So it's more, they're conditioned more to talk about their feelings, where I feel the generation before us, millennials, generation before them, millennials, we allowed that space. We were in this place where we had the influence of the generation before, who were potentially like our parents and grandparents and things like that, but also we also wanted to talk about it. So being able to have this like gradual progression of what it is to feel more comfortable with talking about it. A lot of us are the practitioners. Even if we didn't have the space to talk about it with our parents, we became the practitioners that became the space for the generation after us. So it's this great way to kind of bridge that. So it's been this gradual progression where the stigma has also been alleviated. The very thing that was creating the barrier also became the thing to kind of break down that barrier, if that makes sense.
Okay. Well, thank you, Dr. Kalra, you for joining us. So we're just having just general conversation right now about mental health and wellness. And Ashley Shelley, she is the behavioral health facilitator for Paula Anderson Coaching Consulting. So I'm going to bring you in just a second. So Ashley, you mentioned about social media, and we know that Generation Z and millennials, all generations are using social media. So, what are some best practices that you share with your clients about how to navigate social media so that it won't be so much of a distraction and it won't impact your mental health?
That's a great question. As with most things that we talk about in therapy, it's about your relationship with it. We mentioned earlier, I mentioned earlier, Generation Z having this different relationship with social media because they've had different relationships and exposure to very particular devices. And so their relationship with it, meaning a lot of them were conditioned to interact with social media from a very young age, where other generations before, it was like it was integrated while we're already having these other ways of connecting and creating bonds, where that was a part of like some of their foundational ways of connecting and interacting and even learning. How many children do we know had tablets like set in front of them and they will watch the ABCs? So for them, that is a way to learn. And so what I do is I encourage them to be present with and really explore and be curious about their relationship with social media. How are you relating to it and how does it relate to you? And then being able to say, okay, maybe this part of it serves me well, and this may be a part that I can be attentive to. But overall, the relationship with social media is very important. And I'm very intentional about allowing that to be incorporated into our therapy space.
Okay. So, Dr. Kalra, why don't you jump in and tell us about your practice and what your focus area is as relates to wellness, and then I'll ask you some questions.
Sure. Thank you. And I enjoyed listening to Miss Ashley. It's a very, I just kind of chipping in my 2 cent of, uh, obs I would say more awareness of what I have noticed in the community, especially in last 5 years of practice here. Um, Social media, I think, as she mentioned, the connection and emotional relationship we have developed, and sometimes it is about starting with an awareness that yes, we are connected, and that opens the gate for discussion to say what level of change we needed, because it's going to come here to stay. As long as it is not affecting our health, we can still have a good healthy relationship with something which is going to be bringing a lot of positive information in future as well, but it is not threatening our health. And I think that's where Ashley's been spending more time than me on understanding that emotions and behaviors and a thought and perception for how we look at things and feel things. And I think there's a lot of work goes in understanding that. My name is Dr. Kaushal Kalra, and I'm a family medicine physician, and I'm also a lifestyle medicine, obesity medicine physician. So when I am evaluating a person and understanding them from medical angle, um, I take a little different route of understanding and evaluating rather than calling it a mental health piece as a separate piece. Behavioral piece becomes the center of my evaluation for everything. When I'm understanding somebody from family history to their work history to their medical part, I'm trying to kind of understand what thoughts goes towards what decisions they are making. Because treating diabetes and treating hypertension or obesity as a medical issue, it's very tough and challenging. But when you look at a perspective from why that happened, and a lot of time functional medicine call it a root cause analysis. So I think understanding the root of how that problem generated, because as a physician, diabetes I don't diagnosed today. Diabetes was diagnosed today as a number, but it started 20 years back. And especially when we are talking about this month, which has been focused on minority mental health awareness, we started noticing very high prevalence of metabolic disease and mental health. And there's a lot of connection. That is why I try not to separate physical and mental differently, because they are so much connected. When I'm treating diabetes, I want to know their mental health. When I'm treating their mental health, I wanted to know how's their metabolically doing. So it is so intertwined that it says, I believe in holistic medicine. I believe in providing a comprehensive care where a person who's already struggling with juggling with a lot of pieces has not to run around. I go to the doctor, I go to a dietitian, I go to a trainer, I go to the gym, and I see a counselor, I need a therapist, or if they have any injury, then they also go to physical therapy. So we thought about a different model of practice to say we want to provide everything under the one roof. We want to provide something which is not in a rush. So that is the whole concept where we started Health 360 Wellness Clinic. So Health 360-degree Wellness Clinic is focused on providing a comprehensive integrated approach where you see a physician, you can see a dietitian, you can see a trainer or exercise specialist, you can see a behavioral health specialist. If you need to do any blood work, EKG, if some special testing we do because that's more scientifically advanced, like body composition, metabolic testing, VO2 max, that's kind of help us understand these are just a tool. Sometimes we don't need it. These tools are helpful to understand which is more sensitive and specific way of analyzing the body. It does not tell anything about mind. It does not tell anything about emotion. That person is still a human. That person is still going through a struggle of carrying a burden of a disease. We have to bring that at a ground level of you're not diabetes, you're not obesity, you're not hypertension. You're just a person who happen to have a particular abnormalities in the number and we labeled a diagnosis. When we work together comprehensively, we can reverse that. So when we are treating diabetes, first thing we are trying to set is a mindset. We are trying to bring at, sometimes I wanted to bring myself at their level, and they also bring them with the knowledge to a little next level to say, let's come up at the same level. You still going to be driving your life. I'm just here to guide you. Just because I have a little extra knowledge, or my dietitian have more knowledge, or behavioral health specialist like Ashley has gained the knowledge working in that field, so we know what works for other millions of people rather than trying and testing it again, then we personalize it. So if a behavioral health specialist is doing a cognitive behavioral therapy, understanding stress eating behavior or anxiety related to a social media or a panic attack, we have a certain tools that we understand an individual, but eventually how it's going to apply for that person is completely personalized. We even don't know until we sit together, opens up a question. So we realize that this kind of practicing medicine cannot be done in a rush. So we schedule longer appointments. We don't do 15 minutes appointment because that's where we are rushing behind the healthcare. So we schedule longer appointment. I'm not in a rush. My patient doesn't feel rushed. We starting with a discussion on open-ended questions, see where they are in terms of state of mind for behavior, state of mind from where they're coming from, social angle, coming from behavioral, their profession, what kind of burden they are carrying. And at the same time, I think one of the big things which differentiate that is understanding their belief and their purpose. Because at some point, I think over last period of time, we have left that, especially in the newer generation, I started noticing I sometimes consciously and very sensitively tap in to see what's their belief, what's their purpose, and then let them think. Rather than I feed an information, I want to have their words comes out and rephrase them and then explore that because we need to bring that anchor. We need to make sure I am matching up as a healthcare at Health 360 Wellness Clinic. I'm matching up to understand their belief, whether that is coming from religious background, a spiritual background, a cultural background, or purely coming from a data driven. A lot of people come in with a data driven, and I wanted to come to that scientific angle of details. So that's why I kind of look at Health 360 degree as integration, comprehensive, scientific, data-driven, cultural sensitive way of approaching without any rush. And that is how I define Health 360 Wellness Clinic.
Okay, well, thank you so much for that great overview. So, back in 2019, I did some extensive research on mental health. I was taking a class at the University of Memphis, and we had to come up with a topic that fell under the umbrella of social justice. And so, we had talked about Black Lives Matter, we had talked about economic inequality. So I chose mental health. And there were several articles that I used as a basis for my research. And one article was the link between food and mental health. And so, Dr. Kalra, you just mentioned about diabetes and treating that and making sure that you approach it from a mindset. So, let me get you guys to just kind of give me your thoughts on what you eat and how that can impact how you feel. So, whoever wants to go first.
Ashley, go ahead.
Well, that's a great question. That's a great prompt to even speak about because I mean, not to oversimplify, but literally you are what you eat. So depending on what you eat, it's really gonna impact. That's what you're digesting, that's what's nourishing you, and noticing if you are eating things that are actually nourishing your body. How does that impact? All of it works together. The integrative approach, everything works together. So how you eat will impact number one, how you feel. And then it could also impact how you feel about yourself. But then we also think about the things that have also influenced that. What you eat sometimes is also and what and how you eat sometimes is directly impacted by your culture, the culture of your home. So there are also feelings that involved into with it. Some people are emotionally eating. Sometimes there's this idea of disordered eating. Well, what you have control over is your food. And so there's this very complex, can be this very complex with not only what you're eating, how you're eating, the things that influence, meaning my mom cooked it this way, so this is how I cook it. And so the idea of deterring from that or creating a space or a boundary, changing that behavior can also impact how you feel about yourself and how you feel about your family. So it can be a very layered experience, but what you eat and how you eat can directly impact how your body feels and also how you feel. And so there's so many levels to that, but I would definitely love to pass the mic over.
Thank you. Thank you. I think you kind of, and I'm gonna just go a little one step back and say food is a necessity, and it is a very important part of maintaining a life. And it has centuries back, it was started as a necessity to sustain life or survival. We started our human life to sustain, and then industrialization happened in 80s, and then we switched gear towards from survival eating to a pleasure eating. So just give you a kind of background, and I'm sure you all know that, but I think for viewers it's very helpful to differentiate that our prefrontal cortex, there are two parts of our brain, which is cognitive mind or prefrontal cortex that helps with understanding when we are actually hungry. But our limbic system gives us a perception of I feel good. It's a pleasure eating. So it becomes we and when we look at a practical angle, the both are we. Pleasure eating is me, and my cognitive or actual survival hunger is me as well. And a lot of time we are eating for both reasons. I'm eating because I'm hungry. I'm eating because I feel good. So, especially when we look at medical issues where we started seeing a dysfunction in appetite regulation, we started noticing that limbic system becomes very strong drive for eat. We stop eating healthier food because it doesn't taste good. We started eating unhealthy food a lot because it tastes good. So we started relying too much on our sensory organs and our limbic system to make a discussion on we are eating for pleasure, which was our secondary measure, not a primary measure. And that's where we started seeing a significant shift in our past in like 80s to now is significant metabolic problems going up, significant risk factor for behavioral problems started going up. And these things are going hand in hand. Things can be suppressed But then when it comes out, it becomes, um, we just see the tip of the iceberg there. So coming back to, as Ashley said, food is medicine. Food is who the human body is. And a lot of time when we are making a judgment call, we're trying to understand, is that person who is sitting in front of me is eating because of survival or for hunger? And just to make it very clear that we're not trying to change. First step of that change is to bring that awareness to that individual, that they can start associating that, oh, I'm hungry. Oh, I'm not hungry. And I'll just give a funny example. Like, me and my wife go to the restaurant and we were eating and we had a good meal. We had a salmon, we had asparagus, we had potato, we had rice, and we were not hungry after eating a good meal. And then the server came and she said, do you want dessert? Do you want that? And do you want to look at it even? And my mind was prepared that I'm not hungry. And then me and my wife looked at it and it triggers. We were conscious, but it still triggers of that conditioning that we have developed of pleasure. Chocolate lava cake, I need it now. And then a cognitive mind and emotional mind is kind of flipping back because we give ourselves knowledge to say, okay, let's do it. Let's share. Let's go for workout tomorrow. So we actually found a balance here to kind of say, okay, let's do it because we go out every 2 to 3 weeks and we can kind of enjoy that. But we made that conscious decision. So I think when I am evaluating somebody at a biopsychosocial way, um, initially we are not, and I'm going to let Ashley speak about that because that's her role. And in my clinic, Wanda Williams is our behavioral health coach, and that's her role to kind of have that mirror to see how you're coordinating and associating your hunger. Are you eating for hunger? Are you eating for survival? Be aware. Don't discriminate. Don't try to fight. Let it happen with the flow when it happens. And then you will be surprised that people change so quickly, which is a wrong conditioning for 10 years, 20 years. People change in 4 weeks. We just show them that this is what is for hunger, this is for limbic system. What do you really want? They already told us priority. This is what they want to be. What is their purpose? And now we match up. Does it match to your priority? And I'm nobody to decide that. What do you say, Ashley?
I love that. It sounds like mindful eating, and that's a practice, that's a tool. It's like, okay, well, let's be present with not only what we're eating, why we're eating. When you mention like the dessert menu, there is this like almost trigger. It's a trigger. It stimulates like, oh, okay, not only is there a dessert menu, there are these things that I can look at, and then your mouth starts tasting all these things that you're looking at. And what I heard you say is you and your wife, you decided to be present and say, no, we're not hungry. No, I don't need this for survival. And also, what might be offered in this moment. And there's a moment of connection. There's a moment of self-awareness
Yeah,
that you both got to share in. There's a moment of enjoyment, nourishing. It's not only what we're eating, but the experience of eating can be nourishing. And you and your wife allowed that moment to be nourishing because how we feel as we're eating, what we're thinking as we're eating is also a part of that experience. And what you all decided to do is say, let's share this meal here and enjoy it. We're going to be present, and we're also going to share a moment and work out. We're also going to be physical together. So we're not going to judge ourselves. We're not going to punish ourselves. We're going to allow ourselves to be present with this. We're going to mindfully eat this. We're going to eat this from a place of higher thinking. And also, we're going to connect another mindful practice with that. So I'm here for all of that. Those are some of the very real supportive practices and tools. Like, what is our attention and how does this serve us? You said we have our priority. And does this line up with it? And that's what mindful eating, that's what that practice of mindfully eating could actually say. I know what I want. I want to feel good about myself. I want to feel good about my body. What is this serving? How does this serve me in this moment? Let's be present with where we're eating. And before you know it, those behaviors do change. That thing that used to be instinct that you would sit and eat, now you're being present with it and you're like, oh, well, this is actually how I feel about this thing. I actually don't need that as much. So it's a great practice to lean into. That mindful eating can nourish you in so many different ways, not only what you're eating, but the experience of it, the CBT, the cognitive aspect of that.
That's true. And then a lot of complicated terms, and I'm not trying to, and I'm sure she's kind of thinking that. I don't know what audience we are looking at, Paula. If we are talking about a general population, we don't want to throw in a lot of medical terms like
Hmm.
CBT, dialectal therapy, and but there could be some um, behavioral health specialists and physicians and dietitians looking at. So we can be more detailed. If they ask more question, we can be very specific with that.
Mhm.
Okay. So let's transition a little bit into psychotherapy. So we know that that is a form of talking. And even though you may be prescribed medication, and this is some research that I conducted, you still have to start with the talking aspect first. So from your perspective, Ashley, how do you view psychotherapy and how open are individuals with just talking about what the issues are that they are experiencing?
Hmm. Well, once they've come into I'm in private practice, so once they've come into the space, they've already specifically decided that they would like to initiate these conversations. So an openness willingness, there we are. The willingness creates the space for the openness. So what I do is I allow people to connect with the willingness, and then we work towards what that openness is. The fact that you're coming into the space and talking about yourself, that gives us the opportunity to talk about the issues, the concerns. So the willingness creates that space for the openness. And in my space, in the space that I work in, the clients that I interact with, there is this very real willingness and openness to talk about themselves and all of the things that are of concern. And outside of the therapy space, in a community space, I'm a yoga instructor, so I find that when people feel not always emotionally safe, that may be an aspect of it, but if nothing else, when they feel accepted, when they just feel as if what they have to say matters, that openness just kind of naturally shows up, even outside of a clinical therapeutic space. But creating that therapeutic space wherever you may be, such as a yoga class or even panels such as this, I find that people once they connect with the fact that my voice matters, my experiences matter, then that openness starts to really just show up. The willingness starts to show up, and then that openness shows up. So the psychotherapy aspect of it, the talk therapy, I've noticed that there's been a consistent progression in the growing in that openness to have these meaningful conversations in a clinical setting as well as clinical setting adjacent.
So, Dr. Kara, do you assess the mental health aspect when they come into your practice, and then do you make direct referrals, or is it something that you handle in house as a part of your integrative approach to medicine?
Both ways, I think what I'm looking at is from patient-centered approach. When patients coming in, every person is being evaluated. We are going through PHQs, we are doing anxiety score, we are reviewing their mood, we are trying to understand them at a human level, ACE score, and all that screening has to be part. But something which is go beyond screening is a personalized care and understanding them. And when I'm diagnosing somebody and then I started noticing a pattern, sometimes it's a subclinical anxiety or depression, but some have clear diagnosis as well. They carry or they already come with a diagnosis where we start noticing that before I'm making any changes on a lifestyle, that person is not prepared for um, active intervention in terms of nutrition or exercise or medical. I think sometimes we just take a one step and focus on just behavioral part because there's a strong predictor, which means if I just specifically look at stress eating, if somebody is going through a stress eating and I see that they are ready for change and they really have a strong indicator for going towards reversing a diabetes, um, I do not put them on a diet class. Don't put them on exercise. I think we need to address the root cause. And that's where I would consult either my behavioral specialist or I would look at who is covered under insurance, or if she already has connection with somebody, and then I connect with him or her to say, how can we collaborate together so I can start collaborating with your behavioral health specialist, and then make a collaborative decision on there is a lot of mutual understanding here going on. Our purpose is same to help that person. You're looking from behavioral angle. I'm looking from medical. I think we need to heal her A1C of 8.0 because she's chronically fatigued and tired, but we need to work together to see how does medicine fits into the psychotherapy. But one thing strongly I believe is medicine is not everything. Medicine is not complete without psychotherapy in those kind of situations. And a lot of time we have proved that psychotherapy itself can be a complete treatment by itself if it is done in a right comprehensive way. And medicine can be an add-on to a psychotherapy. And that person can be doing a psychotherapy. And now the question comes is psychotherapy at what level? And that's where I just kind of strong belief is every person of my team has to be a psychotherapist at some basic level. My nurse practitioner, she should understand motivation interviewing. She should understand how to intervene. It does not have to be a behavioral health specialist because when we start noticing a very high prevalence of anxiety, depression, mood disorders, and metabolic disease at the same time, I don't think it's a responsibility only for a psychotherapist to evaluate and treat. It should be every team on a healthcare should be addressing that. So my dietitian is evaluating the behavior. Her expertise is more in nutrition, but she has a basic understanding to say, okay, who she can evaluate and bring her back, or who she need to bring behavioral health specialist in. So same for exercise coach. We're not trying to push motivation here and then exhaust them and 2 days of they will need a 2 days of break to recover. We're trying to have every exercise specialist understand how to understand a behavior and motivate them in a most positive way. Physician, nurse practitioner, dietitian, and exercise coach or physical therapy. They have direct connection with our behavioral specialist. If we are working inside our integrated clinic or outside our integrated clinic. We collaborate there to say, how can we bring this to a comprehensive way for that person being the center where we are? And I would say 70% of the time we handle it internally, but there are times that we have not have enough resource that we need to collaborate externally and then work together to make it a complete program.
Okay. So the American Psychological Association wrote an article back in 2012, and it was talking about the prescribing of medication. And so in 2010, it states that $16 billion was spent on antipsychotics, 11 billion was spent on antidepressants, and 7 billion was spent on drugs to treat attention deficit hyperactivity disorder. So what I'm hearing you saying is that even though you have to have medication at some point, but sometimes if you people may be skeptical about getting on medication because they don't understand the long-term impacts of being on medication and whether or not it's actually solving their issues. So can you guys speak to that, how the medication can help, and then how people can feel more comfortable when they are prescribed medication?
Yeah, as I was telling you that it's going to be a combination of everything. Understanding it, doing it psychotherapy and psychoanalysis, and the last piece comes is medical part. Medications do play a significant role. We especially talking about short term and long term. It has shown data that it can reverse and it can put people on remission for a period of time. I think the big question come here is how much of that disorder or disease causing functional impact. And that kind of is a driving force for bringing in all to all tools on the deck and all making a decision aggressively versus where I would say I want to collaborate here, I want to work with my therapist and give it a little 4 weeks, 6 weeks, or somebody is going through a suicidal thoughts and ideation, and I'm not comfortable just with therapy. I want to bring medication. So I think it will be an individual decision for me that I evaluate how much functional impact it is. Um, and a lot of time it is a burnout. Sometimes we need to go to a talk therapy and then things change within 7 days. But it is a combination of both.
Agreed. Absolutely. Agreed. There are times, even just symptoms, sometimes the collaborative care is key because symptoms can be treated with medication and also when we get to the functional level. And I'll just use this as an example, such as difficulties concentrating. Of course, there are medications that can help you like focus, but then when we get to the functional aspect of it, the difficulties concentrating is coming from feeling anxious around stressors. So we get to the idea of like, let's attend to the anxiety, let's attend to the stress, and then those difficulties concentrating become less. And so medication management may change. It doesn't mean that you may completely come off of it, but the management of that may change. So it definitely works together, and having that information, having that insight can be very helpful for a client to have them have that collaborative care to be able to speak to their medical health care provider and also their psychotherapist to say, these are the symptoms, this is what's happening. And for us to be able to work together and say, okay, well, this is how medication can help us to even be able to show up and be present in psychotherapy. So it definitely can work hand in hand on an individual basis.
Okay. Well, let's go ahead and wrap up this conversation about National Minority Mental Health Awareness Month. So I want to give you guys the opportunity to just give some closing remarks about the month and then just maybe some next steps for individuals that are listening to this panel discussion.
Go ahead,
Well,
Ashley. You started first, you went first.
thank you. Well, just the fact that we're having this conversation because I'm hearing both of us, both providers, speak about the client and patient centered focus. And one thing that is very important is the cultural competency around that. And so being present with the person as an individual, we're allowing them to come in as their whole selves and making space for the cultural implications that can come from that. And so in relation to and really in reverence of minority mental health awareness, this conversation alone, making space for individuals, is very important. And one thing to carry forward that I would offer and I encourage people to really connect with is your individual experiences matter. Your individual culture matters, and being able to find a space, connect with a provider that values that and that honors that, and if nothing else, just acknowledges that, that can be beneficial for long-term, sustainable, effective outcomes.
Perfect. I enjoyed talking to you both. And thank you everyone for giving me an opportunity to talk on this special time. As a physician, we're trained to diagnose, prescribe, and intervene. But healing often begins in the space between where biology meets stories and a medicine meets meaning. And in mental health is not just a cultural concern. I feel personally it's a clinical priority for me. And we are talking about neuroendocrine disruption and inflammatory pathways and trauma mediated medicine progression. And there is systemic barriers that delay care until it's too late. So if we truly aim to prevent chronic illness, reduce polypharmacy, and improve quality of life, we must integrate psycho, social, cultural, humanity, and social context into every clinical decision. And at Health 360-degree Wellness Clinic, we believe the future of medicine lies not just in what we prescribe, but in how we listen, how we ask, and how we connect. Because no biomarker, no blood work, no diagnosis can exist in that vacuum. Once we feel we are all family, we all connect at that same ecosystem, healing starts. And we are all here to serve with both precision and compassion. And we must treat not just the disease, but the person living with it. So that's my hope and a wish, and I am hopeful I'm going to have more opportunity to work with each one of you at some point. And thank you so much for giving me an opportunity to talk here.
Well, thank you both for sharing your knowledge and your experience with mental health. There'll be more conversations that I'll try to have later in the year. So I'm going to stop the recording now.